Sorry.
Gotcha. All right. Well, I have 1:15, so we will go ahead and get going. Welcome everybody to our bi-weekly, briefing on COVID-19 for the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I am Chuck Carney, Director of Media Relations for Indiana University, today coming to you from the IU Kokomo studios. We will start with our opening comments, first of all, from Mayor John Hamilton.
Thank you, Chuck. Impressive from Kokomo. You're getting better at this all the time. That's good. Nice to be with you. Just briefly give the quick updates I do about city stats. We had 3 new cases among our employees this week. So that's kind of as high a number as we've had in the recent times. About just over 70% of our employees have demonstrated their vaccination status, that they've completed that. I will note quite striking increases in the water utility, wastewater plant testing in the most recent testing. You may recall the detectable limit is 10 copies of the RNA per 100 milliliters. We've had periods when it was undetectable. The last few weeks, we've had 22 or 28 at Blucher. The most recent number was 180, so that was a big bump up. In the Dillman plant, which covers the south part of the city and west, we had numbers of 80 and 140 most recently, and then this week's number was 670. So those are really significant. Again, we don't know all the science of this, but I did just want to share that those wastewater plant testing that we're continuing has showed a significant bump up in the presence of the RNA related to the virus in the wastewater stream. I'll note as well, moving forward, we are significantly moving forward in the city with implementation of the Occupational Safety and Health Administration Emergency Temporary Standard. This is the one that was released about a month ago. We are validating now vaccine data that will be reported as to our current active employees. We've been doing roughly approximating percentages before, but we are now beginning to validate that formally. We announced earlier this week that all unvaccinated employees, and again, we're validating that under OSHA, they will be required to wear masks consistent with the OSHA rules effective Monday, December 6th. Supervisors in the city will be issued lists detailing the names of employees who have not provided their voluntary proof of vaccination. So that is a new step in the city that we're doing to move forward with the complying with the OSHA rules. One step is December 4th, effective December 4th, and then another is effective January 4th. I know we'll be talking about Omicron. I'm not sure how to pronounce it, but that's obviously very sobering news. I know we'll hear about that. We'll hear about changes locally. I'll just say it encourages us, to me, to stay the course locally. I know, of course, we'll continue to listen to the experts and the science on that as we have, and thank all of those who do that. And the last comment I'll make is just, I know one of our great strong partners, IU Health, has a very big weekend coming up. And in the face of all the stress and pressure on healthcare, I hope we all can extend a great particular word of thanks to those who are working in that field and wish you the best of luck in an extremely complicated and challenging move. We're very proud of what you're doing in our community, and I hope everybody can stay safe and get that done as we continue to work on this pandemic, which is still with us. And I'll hand that back to you in Kokomo, Chuck.
All right. Let's next go to Monroe County and the Department of Health and Penny Caudill.
Good afternoon. And Mayor, your information on the water testing is just a segue into where I'm starting today. Yesterday, we had 94 cases reported to the dashboard, the largest number of cases reported since January of 2021. When we had 104 cases at that time, today's cases were in the mid 70s. I think it was 74. When I looked back through my data notes, I found days that were in the mid 70s in the first week of January of this past year, followed by that 104. In the end of July, we had 58 cases reported in one day. So we have seen that big jump that you were talking about as well. With over half of our eligible population vaccinated, some people may be asking, why is this happening? Well, while half of our eligible population vaccinated may be much better than some surrounding counties, it is not good. It's not nearly high enough. Mask wearing indoors and in crowded situations is waning, and it is clear that people are not staying home when they are sick. If you have a fever, symptoms, you're not feeling well, please get tested, stay home and away from others. Isolating yourself reduces your risk of infecting others around you. If you are a close contact and you have not been vaccinated, then you need to quarantine, stay home, away from others, ideally for that 14 days from last exposure. If you test after 7 days and the test is negative, then you may be able to go out as long as you are masked all the time when you are around others. If we don't do these things well, then this virus will continue to circulate and continue to mutate into new variants. This really is in your hands, so please do your part. Let's knock this virus to the curb this winter. Containing this virus means less illness, fewer hospitalizations and deaths, and it also means fewer regulations are needed. On the vaccine front, with vaccinations now available for younger children, Dr. Linton Talukian from our Board of Health facilitated a panel discussion on Wednesday evening with 3 other local pediatricians. They answered questions about COVID-19 vaccine for children during the hour-long session. Recordings of the town hall are available. You can get them at CATS TV and on our calendar events on the Monroe County webpage. And we will be having a link to that as well on our health department page next week. And I will put those links in the chat here in just a moment. So that is available for anybody to take a look at. And I want to give my thanks to Dr. Laughlin, Moore, Simmons, and Talukian for their time and their expertise. Since the pediatric vaccine was introduced on November 3rd, more than 64,000 children ages 5 to 11 in Indiana have received their first dose of COVID-19 vaccination and are scheduled to receive their second dose in the coming weeks. This represents a little over 10% of the population in that group. We continue locally to vaccinate children 5 to 11, those 12 and up, and provide booster doses in our clinics. The school super shot clinics were busy. We vaccinated about 100 students. Our nurses are now going into individual schools, as well as managing the Monroe County Public Health Clinic on Miller Drive and doing other outreaches. I want to give thanks again to not only our nursing staff, but to our volunteers, including firefighters who continue to assist in these vaccinations. Demand in Monroe County is high, and that does make challenges for getting appointments quickly. The data that we have indicates that we have over 2,400 of our 5 to 11-year-olds receiving their first dose of vaccine, and over 400 are fully vaccinated. The mobile clinic that was here on the 17th through the 20th reported doing over 1,000 vaccinations, with about 80 of those being in the 5 to 11-year-olds. Over 400 tests for COVID-19 were performed. While I was hoping for a higher number of 5 to 11-year-olds to be vaccinated at that clinic, I was reminded by another health department administrator this week that they would be thrilled if they could get 80 children vaccinated. So that seems like a very small number to us. Other counties are struggling to get just that small number done. We continue to invite these mobile clinics to our community as long as the interest is there. Remember, you can get your flu and COVID vaccine at the same time as long as your provider has them both available for you. Just want to mention the Omicron variant of concern just a little bit. It is a new SARS-CoV-2 variant that's been identified in many countries, including the US, and is categorized as a variant of concern by the World Health Organization. Because we don't know a lot about it yet, we do need to remain vigilant about how we handle ourselves, and layered prevention strategies should be used to reduce transmission of COVID-19. These strategies include things we've already talked about today: vaccination, masking, improving ventilation, distancing, hand washing, and testing to slow the transmission. The CDC recommends that everyone ages 2 years and older wear masks in public places, indoors, and areas of substantial or high transmission. Monroe County still has a requirement for this due to our high level of transmission. Unvaccinated people should wear masks regardless of community level of transmission. Masks are still required in indoor areas of public transportation and the U.S. transportation hubs independent of vaccine status. People who are a close contact with someone with COVID-19 should get tested 5 to 7 days after exposure, even if they're asymptomatic. Wear a mask indoors in public places for the 14 days following exposure or until your test is negative. Persons who develop symptoms of COVID-19 should get tested and stay at home until their test result is negative, or people who have a positive test need to stay home for those 10 days of isolation. On the vaccine front, vaccination remains vital to COVID-19 pandemic control, and we will await more word from the CDC as they find more information out. Back to you, Chuck.
Okay, let's check in with the Monroe County Board of Commissioners and Julie Thomas.
Thank you so much, Chuck, and thanks everyone for being here. First, I want to start off by saying that the Monroe County government has decided to offer a vaccine incentive to our employees, $1,000 for full-time employees, $500 for our part-time employees. We're really excited about that, and we hope it changes some minds. But no matter what, we do encourage folks in our community, if they're eligible, to please get vaccinated, get the booster, do everything you can, including wearing those masks. We are trying to protect our healthcare workers, and they've got a huge move ahead of them. And even beyond that, so much work that they've done over the last 20 months that we can't thank them enough for. But this is also to keep our small businesses going and to keep our vulnerable people in our community protected. So please do everything you can. We appreciate that. And note that the Township Assistance Fund, we added another $25,000 to it. So we're now at $150,000. That Township Assistance Fund is available for county residents anywhere in the county, whether you live in the city, a town, or neither. Every county resident lives in the township. If you need help paying for basic necessities, rent, utilities, things like that, please contact your township trustee as soon as possible. You can find that information by calling 211 or going to in211.org. And also a note, we have 2 blood drives we're sponsoring in December. Thursday, December 16th, 10 a.m. to 3 p.m. Friday, December 17th from 2 p.m. to 7 p.m. Both are at the Mill, 642 North Madison. Please go to redcross.org to make your appointment. Lastly, a reminder, we do offer a resident alert system for every county resident. Just go to co.monroe.in.us, click on the megaphone and sign up. You can choose how to receive information, text, email, or phone call, or any of the above combined. But this is vital information, not just about weather and road advisories and travel advisories, but also related to any announcements that come out of our health department. Those are also posted immediately. So please sign up and utilize the service. We've had a huge increase in the number of subscribers, and that's a great thing because informed residents are better residents and happier residents. So with that, we'll take questions. Thank you.
Okay, so next go to IU Health and Brian Shockney.
Good afternoon, everyone. Thank you for joining us. We are unfortunately seeing another increase in our region's patient numbers since the last time we were together, as our numbers have nearly doubled in the last week. We're seeing the same trend in the numbers between IU Health Bloomington and Monroe Hospital and their COVID admissions as well. We didn't expect to be increasing in cases so soon again, but as temperatures turn colder, vaccination levels continue to remain low across the country, and in some of our areas here in the South Central region, we're once again seeing a spike, as Penny shared earlier. According to the Washington Post, states such as our neighboring Michigan saw an 86% increase in COVID cases and a 37% increase in hospitalizations in the month of November, narrowing in on the numbers that rivaled their peak experience in April of 2020. We also are seeing early indications of the same level of increases of positivity and hospital admissions, not only at IU Health, but also across the state of Indiana. The hospital admissions and census in our district mirror the Indiana pattern. On the screen here, you see the recent pattern since July of this year. We never recovered from this current surge as we did in the previous surges. And here we are ramping back up with infections, hospitalizations, and unfortunately, deaths. As our team continues to find hope and look forward to our move to the new IU Health Bloomington, our team and healthcare workers across the country are tired of this continued battle we face. So we urge you to get your vaccination. Get your vaccination now. Get your booster vaccine if you have not already done so. We are truly fortunate to have the partners on this call who are devoted to vaccine availability in our community and continue to remove any barriers that stand in our way as individuals of getting our vaccines or any other information that we need. I'm happy to take questions at the end.
Okay, well, next go to IU and go to Aaron first and then Kirk. And I'm going to be off camera for a moment because I have to plug in.
Sure, Chuck. No, happy to. You know, as everybody has noted, things have been somewhat worsening in Indiana, and it's the same story, although to a much, much smaller extent on our Bloomington campus. We definitely saw more cases in the last week than we have previously. I'm sure that's partially due to cold weather, partially due to Thanksgiving and people traveling and perhaps getting in groups that they otherwise wouldn't be in. And it's also possible that it is just something to do with the virus and how it is spreading. Regardless, we are continuing to push boosters. We're continuing to push out messaging for all of our students who are 6 months out and should get a booster that they should. We're doing everything to make sure that that is available and that they can get boosted. We're continuing to push flu shots as well and continuing to advocate for all of the same behaviors that have kept us safe throughout this pandemic. While the numbers are increased, they're still reasonably low. Certainly much lower than what we were seeing last year. And we recognize that we have about 2.5 weeks until we really hit winter break and most of our students disperse. So we're going to do our best to keep things as safe as possible. And then hopefully the rest of the state can also start to get control of this. But best thing we can all keep doing is vaccinate, vaccinate, vaccinate.
Well, thank you, Dr. Carroll. At the Bloomington campus, just as Dr. Carroll mentioned, and others have talked about here as well, we've seen an increase in COVID cases. And in fact, this past week, our number moved up to 89 total cases. That's the highest number we've seen since the 3rd of September. So that's very consistent with what Penny Caudill reported and the mayor reported in the monitoring that the city utilities department does. So we are very mindful that now's the time to continue the vigilance and good procedures that we have in place, getting vaccinated, wearing masks, washing your hands, keeping the distances, especially as we see the trends that President Shockney mentioned in our neighboring states. Those usually eventually get to Indiana. So we want to maintain that vigilance and continue reinforcing that message. On the vaccination front, we know that there's a lot of demand for vaccines right now, and we still encourage everyone to log into ourshot.in.gov to find the closest place and the soonest, quickest place where you can find a vaccine. There's still plenty of opportunities, but it has gotten pretty busy with the vaccine eligibility opening up. IU is working with our local county officials, Director Caudill, and with the state, and we're hoping to be able to provide some additional vaccine clinic opportunities here in the community before the holiday break. So more to come on that as we continue to work out those details. Thank you.
Okay, and a quick technical note here. So if you have posted a question, the reporters here on the call, if I can ask you to post that again in the chat, because I lost all of that when I lost my power here. So Eric Berman's got one up here, and apologies if I've gotten now things out of order. Loaner laptop is all I'm going to say, and the battery not trusted as much as it should be. Quick question from Eric Berman for Penny Caudill or Aaron Carroll. He says, I'm struck by Penny's statement that people are going out and about despite feeling sick. Several questions. Is that something we're inferring from the rise in cases, or has that issue been documented? Is it, I'll go ahead and ask all of these. Is this more of an issue now than earlier in the pandemic? And if so, does that reflect COVID fatigue or something else? Penny, we'll start with you and then go to Aaron.
Sure. Well, certainly we have reports, whether it's from providers, offices, whether it's from our contact tracing efforts, where people have went to gatherings, for example, even though they had a fever or they had symptoms, those kinds of things. The rise in cases, those are the things that spread infection. And so certainly we know that when people are congregating, especially when they're symptomatic, that we should not just assume that it is seasonal allergies or something else. Go get tested. Make sure that it isn't COVID-19, and do that before you go to that gathering or that event that you are doing, because it certainly does increase our risks. I do think that we've had issues all along with some people isolating well and some people quarantining well all along. But I also think that there is an element of fatigue that people have, that they may not be as careful as they were in the beginning of that. And I think that perhaps I answered those in a nutshell. If not, I'm happy to go back.
Yeah, Aaron, you want to add to that?
I do. We absolutely have seen this. We're seeing it in our contact tracing, where we find people who are positive, and when we're doing the work, it turns out that they've had 2 days of symptoms, which are concerning. I think that there's a variety of reasons for this. One is that, until a year or two ago, it was part of our culture that there was something noble or American about powering through sickness and going to work, even if you didn't feel well. It's hard to get people not to do that. We have students that don't want to fall behind. We have professors that don't want to miss class. We have staff that want to go to work. And so convincing everyone that when you have symptoms, you need to stay home and you need to get tested is still a climb. The second is that a lot of the cases that we see this happen in are people who are vaccinated, and they assume therefore that they are safe, and that when they do feel symptoms, that it's much less likely that they will have COVID. And that is true. It is less likely, but it is not zero. And we encourage them to get tested. But if you have to do this a couple of times a year because you have had colds or other viruses or RSV or enterovirus or the flu, after a while, it just becomes human nature. You start to discount it. So we are redoubling our messaging internally that anyone with symptoms needs to stay home, needs to get tested, needs to stay away until they know they don't have COVID, but that message needs to be spread widely.
So question here also from Eric, send this to you, Aaron. House Bill 1001 has been introduced in the Indiana House, which among other things would repeal IU's vaccine requirement. How much of a concern is that for the university?
Well, I mean, certainly we stand by what we've been doing, and we've been working very hard with the legislature to make our vaccine mandate work with how Indiana would like it to proceed. I feel like we've done a pretty good job. Most of the exemptions and everything else that they are requiring, and the fact that we provide, the expenses for doing weekly testing, if people should choose an exemption, that we're already doing that. We are also continuing to have a very broad religious exemption. In fact, everything is set up very much along the lines of how the bill has been written. The one thing that seems to be different is that that they would like to it seems some would like to repeal the vaccine mandate. We'd appreciate it not. I think, we're heading along the same way. I don't speak for the university when it comes to our, policy in this direction, but on the other hand, we've very much gotten most people either to the place where they are already vaccinated or have an exemption. So this would probably not have much of an effect on us this year. And we would have to shift our policy just to try to make things as safe as possible. But I'm sure that people who are involved in government relations are working closely with the legislature and trying to find solutions that work for everyone.
Next question from Janice Rickert from the Herald Times for the mayor. How do sewage sample numbers compare to previous top numbers? What is the highest we've seen?
Thank you. I think those numbers are available on the website. I'll check, but I just did check that we were in the thousands. We did see at times numbers in the thousands. So these are not nearly as high as we've seen before, but 670 is certainly a lot higher than we've seen in quite a long time. I'll try to find out if those data are all available in one place. I think they may be on the CBU, City of Bloomington Utilities website.
Next question from Brock Turner from Indiana Public Media for Kirk and Aaron. What will IU do if cases continue to increase through winter break?
I think we would continue to do many of the things that we're doing already, that we would continue to encourage booster vaccinations, that we would continue to have masking in indoor public spaces, that we would continue to provide various levels of testing that are very easy, including symptomatic testing, or COVID check testing for those who are unvaccinated, symptomatic testing. We'd continue to push forward our messaging and everything else, but we exist in Indiana. And if Indiana has cases rising to where they are in January levels, it's unrealistic to think that we're going to stay at June levels. But I'd still, as I continue to talk about inside, our numbers are still so much lower than they were a year ago. Last fall was so much worse. We have something like a 90 to 95% vaccination rate, I think, on the Bloomington campus. We are among the most vaccinated group of any group in Indiana. So I don't think that we necessarily pose a greater risk or are more concerned about our population, but we are going to mirror what the rest of Indiana looks like. So we'll continue to do everything we are doing and push it as much as possible, but we still feel like we're in a pretty good place.
Chuck, I just add to that the Bloomington campus coronavirus response unit continues to meet at least 3 times a week to monitor these numbers, the cases. We look at contact tracing. We see where trends are, and we look at that almost a daily basis. So as things start to creep up or we start to see trends, we have all of the procedures in place that we really fine-tuned last year to be able to control, to monitor and control any possible outbreak that increases to higher levels in the coming year.
Okay, and there is a question from Eric, and I'll just address this quickly. Eric, we pretty strictly try to keep this to COVID questions, but I can connect with you that after on that question, get you an answer on that one as well. So waiting for any other questions that we might have. Appreciate everybody's patience as I furiously plugged in the computer here that I had to get connected to power, and I'm sure nobody even knew I was gone. This, by the way, happened once during an Ask Aaron, and Aaron talked and nobody had any idea that I was ever gone through the entire thing, which is as it should be, by the way.
That's not true. We all knew you were missing.
So again, I'll make one final call for questions. If there's one that someone wants to get in under the wire.
Hey, Chuck,
Yes.
one statement did come in kind of to me. I think it was off Facebook, and I can just address that very quickly. It's about the Indiana Department of Health and Gravity testing site, which was on Profile Parkway, moved to the front side. So it's now off of Curry Pike. I tell people it's where the old GE plant was. So in that parking lot. Yes, that is has been an outside drive-through clinic. They did have lots of closures due to the rain and weather that we've had. They are working on that. That is a state site. But I did actually have a conversation with folks from Gravity today, and they have some plans in place that should eliminate the need for those closures. So I'm hopeful that we will not be seeing that going forward.
Okay. All right. Well, seeing no other questions, we will leave it there and plan to join you again in a couple of weeks. And looks like that would be, is that correct on the schedule, or am I getting that wrong? I think that'll be right before the holiday break. Is that right?
Chuck, we are scheduled for, we would probably do the 17th, but we ought to ask Brian about that. I noticed the hospital dedication ceremony is at 2:00 on the 17th. So we may need to look at fine tune that one a bit, because many of us will certainly want to celebrate with the hospital that day.
Okay, well, we will let everyone know if we have an adjustment to that schedule, and you can join us whenever we do that. But we do plan on being back in 2 weeks at some time on some day, so we will let you know when that is. How's that for exactness? With that, good weekend to everybody.
Good luck, IU Health.